The audience can see now. Hello, everyone. Good afternoon for those of you who are in Europe, and good morning or afternoon for the rest of the world. Welcome to the Global Health EDCTP3 Joint Undertaking Info Day. My name is Julia Molto, and I am the Policy Officer at the European Commission who will be moderating this event. So today we will present the Global Health Joint Undertaking and the Work Programme 2022 and the topics within it. With me on stage, I have my colleague Inma and Steffi, who are both policy officers at the Commission with myself. And online, I have Elmar Nimesgern, who is the Interim Executive Director of the Global Health EDCTP3, and Stephanie Lebert, who is the Legal Officer at DG Research and who will be answering your legal questions later on. And now to a short Slido to start the evening. So the hashtag for today is hashtag EDCTP3 Info Day. So you can log in via the event website, and if not, you can go to the slido.com website. So I'm going to give you a couple of seconds so that you start coming in with the answers to our first question. So this would be, in which country are you or is your organization based? I see some answers coming in. So Hungary, Switzerland, South Africa, Germany, the UK. So as the words get bigger, more and more people are voting. Thank you for coming in today and voting for this poll. I'm going to give you a couple of seconds since I see that the numbers are starting to rise. So I see South Africa in big and France in big. So does that mean you guys will? Yes, now, great. Belgium, Tanzania. I see Senegal as well, the Netherlands, the University of Liège, so hello. Portugal as well, Spain, Zambia. Very good. So we're really getting track now. We have over 30 people that have voted now. It's going up and up. Oh my goodness, you guys. Very good. I see a lot of people coming in now. This is why we start with the Slido poll, so that people can start joining the conversation. I'm going to give you a couple more seconds. So we still have France as the leader. Switzerland seems to be second and South Africa third. Now it's Belgium and Italy are polling in. Okay, so I think we have a good overview of the countries that are here today. So thank you all for attending. Now I'm quickly going to jump to a different poll that I'm going to launch right now. And this poll will be to know what your main field of expertise is. So the UK, that was from the last poll, but for this new poll, what is the main field of expertise in one word? So I see some, yes, so I see some coming in again. So tropical diseases, malaria, public health, infectious diseases in general. Perfect, you're at the right place then. E-health, I see microfluidics, very big NTDs, so good. We will fund a lot of projects on neglected tropical diseases with hope for the next years. Again, immunology, epidemiology, pharmacology, everyone is voting now, so the word cloud keeps changing, but that's very good. I see a lot of fields of expertise here today. Microbiology, genomics, amazing, COVID-19, pharmacology again, sleep and sickness, AMR, that's good. It's one of the new features of the Global Health EDCTP program. Okay, so I think more or less you've gathered what people are doing and what we're all working on. So we're gonna move on to the next part of the session. So we're basically now gonna give the floor to Elmar Nimesgern, who is basically gonna give you an overview of what the Global Health EDCTP program is, and who will be explaining as well what the work program consists of. So Elmar, your floor is yours.
needed to turn on the microphone. So good afternoon, everyone, and thank you very much, Julia, for giving me the floor. It's really wonderful to see so many people from all corners of the world join us this afternoon for the info session. So thank you very much also from my side. Yeah, it's really my great pleasure to, in the next few minutes, with a few slides, give you an introduction to the Global Health EDCTP3 program. In doing so, I want to start with actually spelling out what EDCTP stands for. We are all using, or many of us are using this acronym a lot, and it stands for European Developing Countries Clinical Trials Partnership. The fact that we have been abbreviating this and know quite well what we are talking about, I think is a good sign that this program has established itself over the last few years as really one of the leading activities in this important space of global health research. The new program is set up in the frame of the overarching European Union, African Union policy framework of the overarching strategy between the two continents. Another element of the strategy you may have been aware of is the fact that in February this year we had a summit between heads of state and government from both continents here in Brussels. And so we, with this program, really want to contribute to this overarching strategy. We also contribute to the United Nations Sustainable Development Goals, and in particular, of course, development goal number 3, good health and well-being for all. As the number 3 in the title of our program indicates, we are not starting from scratch, but can really build on the success of this program over the years with EDCTP and EDCTP2. As any activity at EU level we want to undertake, we need to have what we call a legal basis. So we need to have an instrument that allows us to do what we want to do. And for our particular case, it is the mentioned Council regulation for which you have the reference on the slide. This Council regulation establishes several such partnerships, in grand total 9 of them. They're all so-called joint undertakings. And then the legal basis has provisions that are common to all of them. And then it also has sections that are specific and dedicated to each of the technical areas that are addressed. And one element, and perhaps in many ways the most important element that is defined in this legal framework, are the general objectives. You have them here on the slide. And the first one is really that we want to reduce the socioeconomic burden of infectious diseases in sub-Saharan Africa by promoting the development and uptake of new and improved health technologies. This is something that we have been doing and has been the goal really of previous programs as well. And then we have perhaps a new focus on increasing health security in sub-Saharan Africa and globally by strengthening the research and innovation-based capacities for preparedness and and response to control infectious diseases. If I can have the next slide, please. Thank you very much. Derived from the general objectives, we also have 5 specific objectives, as you see on the slide. And the first one is where practically a large part of our activities and the funding will be, is to advance the development of and use of new or improved health technologies for tackling infectious diseases by supporting clinical investigations and clinical trials. As a second specific objective, we want to strengthen research and innovation capacity and health research systems in sub-Saharan Africa. Very importantly for us is to align around a common strategy, as shown here under number 3, and a current research and innovation, strategic research and innovation agenda. As we have seen with the COVID pandemic, it is important to strengthen capacity for epidemic preparedness. And finally, as the 5th specific objective, we want to promote networking and partnership, both between the North and the South, but also amongst sub-Saharan African countries. It's a variety of private and public sector organizations. We can have the next slide, please. Thank you. So who are the partners in our joint undertaking? On the one hand, we have the European Commission, which represents the European Union. And on the other hand, we have the EDCTP Association, which represents European and African countries. We also have the possibility under Global Health in EDCTP3 to have so-called contributing partners. In our first annual work program, we already have an example of such a partnership. In this particular instance, it is with the Bill and Melinda Gates Foundation. Contributing partners can come ad hoc, as there's a slide, in specific calls. So they don't form part of the governing board, but they come on a specific occasion. And as Bill and Melinda Gates Foundation is a philanthropy, it can be such types of organizations, but it can also be, for example, industrial players, and it could be other third countries. Out of the total budget of the program of 1.6 billion, half comes from the EU budget, notably Horizon Europe budget, and the other half comes from the EDCTP Association and from associated partners. If I can have the next slide, please. If we try to compare the new program, Global Health EDCTP3, with the previous program, we can say that the overarching mission and the science to be addressed are really very much a continuation under Global Health EDCTP3 compared to what we have done under EDCTP2. There are a few specific new features. One is, for example, that whilst EDCTP2 already did address some COVID-specific calls in 2020, this was not a formal part of the strategic research and innovation agenda, and we have included it. We also have taken up the important issue of antimicrobial resistance. The work we are doing under Global Health EDCTP3 is based on our strategic research and innovation agenda. This was developed starting really by EDCTP2 program at its forum meetings with stakeholder consultations in a very deliberate process over a period of more than 2 years. And in Q4 last year, the EDCTP Association actually formally endorsed the Strategic Research and Innovation Agenda at its General Assembly meeting. And that then was the basis for the joint undertaking when it was established to formally adopt the Strategic Research and Innovation Agenda. A difference to the previous program, if you can just stick 1 more minute, thank you, on the previous slide, thank you so much. One difference from the previous program is that we have a new organizational setup. I've talked about this joint undertaking already a few times. So this is a new legal basis, as we call it. So there is a provision in the European Treaty, the Treaty of Rome, that says that the EU can work together with partners in establishing research programs, and that's what we are doing. The European Commission, as I already mentioned when I explained the partnership, is a formal partner in this joint undertaking. And this new thingy has been set up in January with the constitution of the governing board. And in this governing board, which is the highest decision-making body, both partners, i.e. Commission and EDCTP Association, have equal voice and equal rights. Both are represented with 6 individuals, and so decisions are really taken jointly and collegially in this governing board. And this includes our work program that we are presenting here to you today. And if we can go to the next slide. So the research and innovation priorities of Global Health EDCTP3 are defined in our strategic research and innovation agenda. They do cover the big 3 poverty-related diseases, HIV/AIDS, tuberculosis, and malaria. It also covers neglected infectious diseases, as Julia already pointed out. Diarrheal diseases, lower respiratory tract infections, and emerging and re-emerging infectious infections, all of which affecting sub-Saharan Africa. I already pointed out that antimicrobial resistance is covered, as are a climate crisis, provoked changes in infectious disease incidence, comorbidities, and co-infections. You do see here on the slide the list of neglected infectious diseases, which I will not read out to you. This is really a strict copy-paste from our strategic research and innovation agenda that you can find on our website. I just want to point out that this list is largely identical to the WHO list of neglected tropical diseases. There are some differences, as you see here on the slide, that certain neglected tropical diseases of mycosis type ectoparasites and snakebite envenoming are currently not covered. If I can come to the next slide, and which is the concluding slide of my little introduction here. And with this slide, I want to give you a general overview of the work program, where we will, after this presentation, introduce to you each of the 5 topics open in this year's call, with 2 slides and a short presentation for each of them. But I just want to, before we do that, I want to highlight some general features of this year's work program. I want to start with the deadline for submitting applications, because I believe that is, of course, for applicants a very important and critical date. And we have chosen 30th of August. Now, we fully realize that this is not ideal, but in view of the timeline we have after the submission of the proposals, we need to evaluate. We need to well, first we need to check conflicts of interest with our experts. We then need to allocate the proposals to experts. The experts need a bit of time to read the proposals themselves before they come together in what we call the consensus discussions, when we really, when the experts come up in their panels with the rankings. And then after that, we need still a decision of the governing board to formalize this decision of the experts. And all that takes a bit of time. And if we do not manage to do this before beginning of December, we cannot execute, we cannot set aside the budget, and rather we lose it. And so that's really what drove us to define the deadline to 30th of August. And I hope for your understanding that that may mean that some of you have to busily work on applications in July and August. And again, it wasn't our preferred choice, but we are the first year of the new joint undertaking. I commit to arranging for the calls differently in subsequent years, when we have more lead time and are a bit more flexible in arranging our calls. Now, after this issue of when to submit, another, of course, very important issue is the eligibility for funding. This is defined in our law, and it says that it is limited to legal entities that are established in EU member states, in countries associated to Horizon Europe, and in countries that are members of the EDCTP association, if they are not already an EU member state or an associated country. I have here on the slide the list of countries. This is the current members of the EDCTP association. And this is also what we have in the funding and tenders portal for each of the topics. This is indicated. So when you want to look at an application, you don't have to start looking for it, but it's right there. We also have specific rules for the composition of the consortium. Many of you familiar with EU programs will be aware that typically for many of the actions, and actually most of the actions, you need to have 3 legal entities to make up the consortium. But where these 3 legal entities come from, that is specific for Global Health EDCTP3. Since we want to promote the collaboration between Europe and Africa, we want to have 1 legal entity from Europe and 1 from Sub-Saharan Africa in order for a consortium to be eligible, and then a third one from either Europe or Africa. Other conditions for the call are quite well aligned with what you may know from the health cluster. For example, the scoring. We have the right to object to transfer, like across all of Horizon Europe. We do not have under Global Health EDCTP3 the eligibility of legal entities in the United States. And then we have a very specific feature, and with that I conclude here, which is that in our law we have a provision that the results of our clinical trials need to be affordable and accessible. And we have translated that into specific conditions for 2 of the topics where we intend to fund clinical trials. And we will point this out also in the specific topics when this is relevant. And with that, I thank you and hand back to you, Julia.
Thank you, Elmar. So thank you for your presentation, giving an overview of our program. We will now move on to present the 5 topics that are within the work program 2022. And we will start with Elmar again, who will be presenting Call 0101 on promoting implementation of research results into policy and practice. So Elmar, over to you again.
And thanks again. And so now coming to the first of the 5 topics we have here in the work program. Julia already told you the topic title. This topic is open for submission of what we call research and innovation actions. We are not going to give you here an introduction to the different types of projects that we fund, but research and innovation actions are our typical research projects that we support. We dedicate close to 40% of our overall budget this year to this topic. So the overall budget we have available is 100 million, and we dedicate 38 million here. We expect that projects of around 4 million euro could be fulfilling the expectations of this topic. You will see here from this presentation that the structure of the work program and the way the topics are described are very much aligned with what you also see in the health work program overall. So we start with expected outcomes, which in this case includes that we want to promote the uptake of research results into clinical practice in sub-Saharan Africa, so that infectious diseases can be prevented and or patients can have access to safe and efficacious health technologies. We also expect the outcome of wide adoption of research results into national and international guidelines. If I can have the next slide, please. As a scope of applications, we expect that we fund registration and post-registration studies, such as pragmatic effectiveness studies, but also other designs are possible of health technologies to demonstrate their clinical effectiveness in relevant populations. We also expect projects to look at the barriers to uptake of new technologies and how to address them. Next, we want the projects to develop tools for translating research results into policy and practice. Evaluation tools, I should say, so that we can actually see how this translation takes place or not. These are obviously quite ambitious goals, and therefore we expect early involvement of and regular interaction with policy and decision makers, as well as end users, so that we in the end really have the health technologies adopted by health systems. And this is one of the topics where the already mentioned specific core conditions come into play. Furthermore, applicants must use a clinical trial template to describe the planned clinical investigations. Applicants amongst you who are familiar with the health work programs will be aware of this template. It is the same template across the different aspects of EU health research funding. And with that, I hand back again to Julia. Thank you.
Presenting Call 0105 on strengthening regulatory capacity for supporting the conduct of clinical trials. So Emma, over to you.
Thank you, Julia. Well, I'm going to present this very important topic on strengthening regulatory capacity for supporting conduct of clinical trials in sub-Saharan Africa. This is a coordination and support action. The indicative budget is 5 million euros for this year. The expected project size is about 600,000 euros. What are the expected outcomes? Well, among others, is to enhance the regulatory capacity in sub-Saharan Africa to support the conduct of clinical trials. It is also very important that it improves the efficiency regarding the process of market authorization of health technologies or improved collaboration between the national regulatory agencies and the ethics committees. There are much more expected outcomes to be written, that we have written in the work program. Please read them because this is only some examples. Next slide, please. So what is the scope? We hope activities covering the training of researchers, clinicians, and personnel of national regulatory agencies for an efficient and robust regulatory control system for conducting clinical trials and for a responsive clinical trial pharmacovigilance. We expect also mapping of the clinical research oversight and pharmacovigilance systems across the involved countries in sub-Saharan Africa. We also expect that the national regulatory agencies are actively involved in the projects. We expect that the linkage with other existing regulatory initiatives in Africa are clearly explained, like the African Vaccines Regulatory Forum, the Pan-African Clinical Trials Registry, the African Medicine Regulatory Harmonization, the African Medicine Agency, or the the regional centers of regulatory excellence. It is also very important that there is also coherence with other EU and member states initiatives. Again, here I expect you to read the work program because there are much more other activities that could be included in the proposal. Thank you very much. With this, I pass the word to you, Julia.
Thank you, Inma. So now I'm going to pass the floor on to my colleague, Steffi. Steffi is actually going to present two different topics, and she will start with topic 0102 on implementing adaptive platform trials, and then she will move to a related call, 0104, on creating a sustainable clinical trial network for infectious diseases. So on to Steffi. There you go.
Thank you, Juliet. So yeah, as Julia said, the topic here is called Implementing Adaptive Platform Trials. And this is also a research and innovation actions like Elma's topic. And the total EU contribution for this topic is around 31 million euro. And we estimate that a contribution of 6 to 8 million per project would allow the expected outcomes to be addressed appropriately. So here you can see on the slide a few examples of the expected outcomes. A number of large multi-center, multi-country adaptive platform trials that investigate treatment for infectious diseases are implemented in sub-Saharan Africa. And through the implementation of these trials, a coordinated network of clinical sites and also research laboratories will be established across institutions and also different countries. And this network will have the capacity to deliver efficiently robust clinical evidence. Another important outcome is that capacity will be built among African researchers to design and implement large-scale adaptive platform trials. Next slide, please. So with regard to the scope, to reach the expected outcomes, the projects under this call should, of course, implement adaptive platform trials in sub-Saharan Africa that are evaluating treatment for infectious diseases. And these trials should also be able to rapidly evaluate treatments in response to an emerging infectious disease threat. And pathogens within the scope of this call topic are those that cause lower respiratory tract infections, emerging and re-emerging infections, neglected infectious diseases, and diarrheal diseases. So infections that lack treatment options or where treatments are inadequate should be especially considered. And these infections also include infections that are hard to treat due to antimicrobial resistance. And to reach the expected outcome of capacity building, the projects or proposal for this topic should include activities on training in clinical trial implementation and laboratory analysis, in harmonized data collections and management systems to run those adaptive platform trials. So just to conclude with this topic, and through the implementation of the adaptive platform trials, we try to improve the efficient identification of treatment options for infectious diseases. And this, again, similar to Elmar's topic, has the specific conditions to consider. The one is with regard to affordable access, and there can be more read about this in the work program. And then also a clinical trial template needs to be used, and that can be found on the funding and tender portal under this called topic. So the next slide then. So now this is the second topic I will introduce to you. It's called topic 0104. It's called Creating a Sustainable Clinical Trial Network for Infectious Diseases in Sub-Saharan Africa. This is now a coordination and support action, and it has an indicative budget of 1 million. And we expect that projects of which get a EU contribution of 1 million can address the expected outcomes appropriately. So this means that only one project will actually be funded under this call topic. And again, here are a few examples of the expected outcomes. One of the expected outcomes is that the projects will deliver a well-documented overview of operational and effective clinical trial sites and laboratory networks in different clinical settings in Sub-Saharan Africa. And this overview should then form the basis to create an efficient and coordination and collaboration mechanism between the clinical trial and laboratory networks in Sub-Saharan Africa. And the work carried out here is expected to lay the foundation for the creation of a coordinated, permanent, pan-Sub-Saharan Africa clinical trial infrastructure. Next slide. So again, in order to reach those expected outcomes, project under this call, they should address the following activities. But again, these are just some examples. So you have to also look at the topic text on the funding and tender portal. So one example is that the project should conduct a desk review and a mapping exercise of the current landscape of the clinical trial and the laboratory networks in Sub-Saharan Africa. And such exercise should then form the basis for the creation of a larger clinical trial network under which the clinical sites and laboratories will collaborate and coordinate their activities to ensure basically a harmonized approach to clinical trial implementation. This larger network could also be composed of sub-networks in Sub-Saharan Africa, and an efficient coordination mechanism should be established between these sub-networks. And very importantly here is that this to be set up clinical trial network should work in close collaboration with the EDCTP networks of excellence. And it should take into account the already operational infrastructure that was set up by the EDCTP networks of excellence. The network should also plan for common preparedness research approaches and tools, such as clinical trial protocols and data management frameworks. So this would then allow the network to also rapidly respond to adapt clinical trials to emerging infectious disease threat. And also a business plan for operationalizing the pan-Sub-Saharan clinical trial infrastructure derived from this network needs to be developed. And that needs to happen in close consultation of African and European stakeholders. And this pan-Sub-Saharan clinical trial infrastructure should continuously evaluate health interventions for infectious diseases in Sub-Saharan Africa. And that would be my 2 topics.
Great, thank you, Steffi. So, and now, but last but not least, we're going to move on to the last topic of today. It's 0103, Genomic Epidemiology for Surveillance and Control of Poverty-Related and Emerging and Re-emerging Infectious in Sub-Saharan Africa. So this topic is in collaboration with the Bill and Melinda Gates Foundation. Our colleague Michelle Morrison from the Gates Foundation can unfortunately not be here today, but Elmar is kindly taking over her presentation. So Elmar, over to you.
Yeah, and thanks again, Julia, and thanks to all colleagues for having introduced here the different topics. And I'm now concluding this. So this is the topic number 3. And it is a part where, for the collaboration with the Bill and Melinda Gates Foundation, we select the projects to be funded by EDCTP program. This is also research and innovation action. We have a total funding available of 22 million euros, and we expect an EU contribution of around 5 million euro to be appropriate for implementing the projects under this topic. The expected outcomes of this topic include that we would want public health authorities to have access to genomic epidemiology data and evidence to better develop and inform and implement informed public health policies in Sub-Saharan Africa. I can say that, of course, we have seen through the COVID pandemic how important this genomic epidemiology data is. And in a way, we want to really use this also in other areas. This genomic epidemiology data should be leveraged to help inform the design and development of health technologies and interventions that are affordable, accessible, and impactful across Sub-Saharan Africa. The capacity for genomic epidemiology and the capabilities to do this kind of research should be strengthened at national public health institutions and regional public health organizations in the region of Sub-Saharan Africa. If I can have the next slide, please. With regard to scope, on the slide you see a few examples of the activities that the submitted proposals under this topic should address in order to reach the expected outcomes. And I can only repeat what colleagues already mentioned, that of course on these slides we try to make a short summary of the full text that is to be found in the work program. And of course, we need to encourage you once again to read the full work program description, which you can find on our website. And also for each of the topics, you have its full topic description in the funding and tenders portal. But coming back to the scope, here for this topic, the project should implement a translational research project that demonstrates the application of genomic epidemiology to answer a specific public health question pertaining to infectious diseases. And there are just a few examples listed here on the slide. It could be to investigate the burden of disease, the transmission mechanisms, the evolution of a pathogen, the characterization of a pathogen to inform product development, or the design of a public health intervention, etc. So the potential application of this, we can believe, is really very large, and we look forward to a variety of projects doing different things. The data from genomic epidemiology should be integrated with epidemiological, clinical, and genomic data through data integration platform. And we want to really establish a community of practice. And the key point is really that we don't just generate data, but it really has to be used for decision-making and engagement with public health officials and other stakeholders. The need for this data integration that is here shown on the slide should be built into the design of the research study from the start, prior to data collection, to avoid that we that the projects collect large amount of data, and then afterwards one starts thinking on how to actually bring it all together. Proposals should make sure that the data comply with the FAIR principles, findable, accessible, interoperable, and reusable. There should be training activities, and they should be harmonized across the different funded projects. It is important to mention here that the genomic sequencing capabilities that have been built through the Africa Genomics Pathogen Genomics Initiative, Africa PGI, which exists, is expected to be leveraged. So the projects can expect to use this capacity and we don't want proposals that say we are going to establish a pathogen genomic sequencing capability in sub-Saharan Africa, because there we want to build on what's already there through the Africa PGI. We also expect collaboration with the so-called Global Health Network, TGHN, in order to have an enabling environment for improved data science capabilities. You have for this topic the specific condition in the work program that the funded projects amongst each other, but also with the project to be funded under the other action, number 2, sign a so-called become linked action and sign a collaboration agreement under our model grant agreement. That is why it is so essential that all applicants, people who want to apply to this topic, read the topic description also of the corresponding topic. And I should mention that in the work program text, you have a full description of the intention and the plan for this partnership. So there is actually, compared to other topics, a whole extra section that is not directly to be taken into account by the projects as such, with expected outcomes and the scope, but it really explains quite well, we believe, the intention and the plans for this partnership overall between what has been already established with the Africa PGI, with the Global Health Network, and what we want to fund in addition with the new projects to be selected by EDCTP. With that, I conclude here the presentation of the 5th topic and hand back one more time to Julia. Thank you.
Great, thank you, Elmar. So now we're actually getting to the interactive part of this evening, where all of the participants can ask us their questions via Slido. You can see the Slido code there in case you had not seen it before. You can send your questions via the Q&A audience tab with the hashtag. So we've got a couple of questions that are already in, so I'm going to read them as they have come in. So question 1, what is the expected duration of projects? I will let Elmar answer this.
Yeah, thank you. And the answer is that I cannot give you a fixed answer. I want to start with an extreme that in global health research one could very well imagine the justification for some very long-term projects running maybe 10 or 15 years. But our program currently does not really lend itself to this kind of investigation. And therefore, this is really not something that you can usefully submit under our current call. For the rest, it's really up to you, the applicants, to design their project. And what I can say is that the shorter a project is, a priori, the better it is, because it will likely produce results more quickly. But of course, that comes with the constraint that you need to achieve your expected outcomes, and you need to do the work within the scope of the project. And that then leads probably to what you then see if you go to our project database, where you see the duration of projects that are already funded, or you go to the EDCTP website and go to their excellent database of already funded projects. You will see the duration of such projects, but we do not predefine a fixed duration that you can maximally ask for, except really to say that these very long-term investigations, whilst such things may very well be justified, do not let themselves for our program and the type of calls we have.
Perfect. Thank you, Elmar. So now that that is answered, I'm going to move on to the second question that came in. Can proposals ask for budgets that are higher than the project size that we have presented? So I can let Elmar answer the same question again.
Okay, and I hope that also colleagues then take over some of the other questions. The answer is clearly yes, you can ask for other budgets. Again, I think what could be helpful for you to get a feeling for how this works is to go back what has happened. You know, we already have some, certainly we have calls from Horizon 2020 where we already had the same type of principle, that in the work program we had indicated certain indicative fundings, and then you can go and look what the actual projects that were funded, what they have requested. And we do see divergence there. But again, you know, if you know that our total budget this year is 100 million, and that for a given topic we have dedicated, let's say 38 million for the one I introduced to you at the beginning, or 22 million for the one I introduced to you at the end. If you come with a proposal that asks for 15 million euros, you will be consuming quite a sizable size of that available funding. And you then have to assume that the experts will look very carefully at, you know, whether this is justified within the, you know, in comparison also with the other proposals that have been submitted. But really tailor your budget, justify it well to what you want to do, because that is the best way to do. Completely underfunded projects are not a good idea to submit, because the expert will then say, you know, if you have a super ambitious application and you don't have the means to actually implement it, that will not likely not pass very well in the evaluation either.
Great, thank you, Elmar. And the next question is, who is eligible to apply for the grants? And by this I mean the type of organization, or are individuals eligible? I let Stephanie take this one.
Yes, I will let Elmar breathe a little bit. Thank you for giving me the floor. I would like to be a little bit generic, because I know very often legal officers are used to provide or bad news or puzzling answers. I will try to avoid both. As you know or not, the law, as Elmar is calling it, which is the Basic Act establishing the EDCTP3 JU, is allowing to have a broader possibility for eligible entities in EDCTP3 JUs, meaning that there may be entities from, of course, member states, associated countries, but also from countries that are constituent, from countries that are constituent entities of the EDCTP Association, which is the private counterpart of the Commission in the partnership. Exceptionally, if the work program provides it, and for specific calls or specific situation like addressing public health emergency, we can also make some countries eligible. Like, for example, if an Ebola fever, a different kind of Ebola fever is happening in Argentina, and Argentina is not a member of the EDCTP Association, then we can mention them in the call, and we can also consider them as eligible. That's one of the conditions, the main condition of this eligibility. Of course, you also have, okay, this is a question of eligibility, but you also have the possibility to participate, not as beneficiary, but also as associated partners.
Great. Thank you so much for that, Stephanie. The next question is, could we please share the list of eligible countries for funding and the list of countries that are eligible to lead a consortium? So I know Stephanie and Elmar have the answer to this, so if either of them want to come in.
Well, I already said that we have on the website for each of the topics a list of countries that are eligible for funding. As regards eligibility to lead the consortium, there is an additional condition that then maybe Stephanie can jump in. But that is actually something that is still a little bit in flux, because it requires to have a so-called SNT agreement, Science and Technology Agreement. This is a process that is a continuous process where countries make these agreements with the EU. And we did not want to create the impression that this is a closed list of countries. So therefore, we did not put that list there. I can maybe say from a practical point of view, being the coordinator, and Stephanie can certainly say quite a bit more about the roles of the coordinator. For the European Commission and the granting agency, in this case the Global Health EDCTP3, this is very important because it is a prime interlocutor for all matters related to the project. But for the internal organization of the project, who leads which scientific work package and so on, this question should be much less relevant. And with that, I let maybe Stephanie complement what I already said. Thank you.
Yes, indeed, Elmar. Just a clarification. Very often, I know that our colleagues from the research sector are talking about a scientific or technical coordinator or financial coordinator. You have to know that the Model Grant Agreement of Horizon Europe does not distinguish. The coordinator is the one who is coordinating the action, and there is no others. So he cannot delegate such coordination task, and they are described in the Model Grant. And I warmly recommend you to have a look to the Model Grant Agreement and also to the annotated Model Grant Agreement under the funding and portal of the European Commission, because this is a key document that will answer many of the questions on that. But just to summarize, the coordinator is the one that is monitoring the action if the action is implemented properly, that will be the intermediary for all the communication between the consortium and the granting authority, will distribute the payment. This cannot be delegated. For all the other tasks, the coordinator remains free, like any other beneficiary, to use affiliated entities or subcontractors for other tasks that are not listed in the Article 7 of the Model Grant Agreement. And for the non-administrative coordination tasks, like the scientific coordination of the action, they can be carried out by any other participant. They may internally call it scientific coordinator, but for the purpose of the grant, they will not be considered as coordinator. The only one is the one that is in the Model Grant Agreement designated as such.
Okay. Great. Thank you both, Elmar and Stephanie, for the reply. Then we have another question on a generic topic on what is the maximum number of partners that one can have for an application. I can take this, just not to give the floor to Elmar again. There is a minimum number of 3 partners for an application, but unless someone corrects me, there is no number of maximum partners. Just please take into account the higher number the partners are in a project, the harder it will be to manage. So this is up to the consortium itself to decide how it does this. And then to the next question. So are organizations from African countries that are not members of the EDCTP Association eligible for funding? I think Stephanie has touched a bit upon this, but if you can just provide a quick answer as well.
I think the answer is clear.
Yeah.
As far as there is something in the work program of EDCTP mentioning them in a specific cause, they may become eligible. So that's one of the possibilities for them. To lobby in order to get some possibilities to be eligible in specific calls, or in the case of the event of a call addressing health emergency. That's, but they can still be participants, not eligible for funding, but still participant, because associated partners as well can be from all over the world. The only point is that they are not eligible for funding.
Great, thank you.
And if I can just complement a little bit to explain where this comes from.
Yes.
So this was really meant to, we want to have a true partnership between Africa and Europe in the program, and therefore we want to have the African countries as partners in the EDCTP association. And I can report here that Inma, Julia, Steffi, and I, all of us, have really worked, and colleagues from the EDCTP association, from the EDCTP secretariat, and many others, colleagues at the Commission, have worked very hard in bringing in additional countries into the EDCTP association. And we have already seen some success in that, where we have some more members than we used to have. And we continue to work on this. And I would certainly hope that as time goes by, we get more African countries into the EDCTP association, where they belong, in order to be true partners of the partnership. And then for the rest, indeed, participants from such countries can in any case join projects, but for the moment normally not to be funded, except in the mentioned cases that Stephanie has nicely explained already. Thank you.
Thank you, Elmar. So the next question is simple again. Will we, the Global Health EDCTP3, continue with mainly single-stage calls, given that this work program has mainly single-stage calls? Elmar, any thoughts?
I actually could have a very good question. Good that you raised this. No, the answer is that we do not intend to continue exclusively with single-stage calls. I had belabored the point with the time pressure as regards the closing date, but of course the same time pressure also led us to have exclusively single-stage calls. Setting up a joint undertaking is quite a challenging thing to do. We had the law in place only on 30th of November last year. Then we had to establish the governing board, which we did quickly. On 12th January, we had our first meeting. Then we had to establish conditions for establishing a scientific committee and so on. I spare you all the details. But there is a big difference for us, Global Health EDCTP3, as a new joint undertaking, which currently is still managed under responsibility of the Commission, from the other joint undertakings, that many of which are a continuation of a previous program. And so they have their own framework as a joint undertaking and have actually more budget flexibility. So our partners, or colleagues from the Innovative Health Initiative, are having their call similar timing as us. But they can do two-stage calls, because if they don't implement the budget this year, they can carry it over to next year. We unfortunately cannot do that. But next year, first of all, we are much more ahead in the planning. So we are ready now, doing first reflections on the work program for next year. And you can expect a good mix of single and two-stage calls, depending on, the topic. And this will be discussed with our scientific committees. This will be discussed with our board. So indeed, we will have a mix of both. I think for research and innovation actions, we may really go mostly to two-stage calls, but I cannot, it really very much depends on the topic, a bit similar to what you have seen in the health work program. But thanks for having raised again this question. And I call on your understanding for the constraints we have, because the alternative would have been that we don't do calls, and that, of course, was not an option for us. Thank you.
Thank you, Elmar. So now we have a couple of questions that are now getting likes, so it's moving up. So the next question is now, can the US-based entities be included as part of a consortium? So a subcontractor to an eligible entity. Stephanie, could you answer this question?
This question is linked to the subcontracting. As regards subcontracting, as far as the work is performed in the eligible countries or target the countries set out in the call condition, it is possible. But that's one of the some of the conditions.
Great, thank you so much, Stephanie. Then the next question is, are there project offices specific for each calls to be contacted in case of clarifications? So the people you see here today are the project officers, but unfortunately, you should not reach out to us directly and asking for clarifications, you can reach out to the Research Inquiry Service. The link is on the Info Day event, and it will be in this presentation as well. So please reach out, send an email to there, fill in the form, and we will get back to you via the formal form. Then,
And if I may just add, and we will see which questions we get, and so we will post with some of the general questions that we are now have been addressing. We will post this probably on our website also. And for more topic-specific questions, you may be aware that on the funding and tenders portal, there is actually space for topic-specific questions. So far, we don't have any answers there. But as specific questions to individual topics come in, we will be, as Julia said, we will answer these questions, and then we will also provide this answer in the specific section of the funding and tenders portal related to each of the relevant topics.
Great. Thank you for the further information, Elmar. So the next question, it's moved. Now it's on Switzerland. So can Switzerland participate? Yep. Go for it, Stephanie.
As far as I know, Switzerland is not a constituent member country of EDCTP. Under in this context, they cannot be eligible for funding, except if it is provided in the work program in specific calls. So that's the only point.
Great. Thank you,
That's
Stephanie.
the reason why it's important to check the membership of EDCTP association.
But of course, eligibility for participation is open to really anybody in the world,
exactly.
Except for the few exceptions, mostly nowadays, unfortunately, dealing with the illegal invasion of Russia towards Ukraine. So Russian and Belarusian legal entities cannot currently participate in any action under Horizon Europe, including Global Health EDCTP3. For the rest, anybody can participate, and we really welcome as broad as possible. We are really open to that. Thank you.
Great. Thank you, Elmar. So now we're getting some more content-related questions. So under emerging and re-emerging diseases, are there some priority infections as done for the neglected infectious diseases? And I think this one is for Steffi over here.
This Steffi. So for this, yes, indeed, we would consider the WHO priority list as one of the diseases included, and then also that we have thought about it, and the mosquito-borne diseases that are endemic to Africa, and that would then also include dengue, yellow fever, West Nile, and chikungunya. And I saw a previous question coming up about chikungunya, so that these will be considered, and we can put this as a frequently asked question in relation to the call topic, which includes emerging and infectious diseases. So that would be, for example, the adaptive platform trial. So, as I said, WHO and mosquito-borne diseases currently. But we will put this online as well for you.
Great. Thank you, Steffi. And now on to a question on the genomic epidemiology topic. So how will the funds from the Bill and Melinda Gates Foundation be integrated into the projects on a practical level? This, I'm going to let Elmar give it a go. Elmar?
Now I'm unmuted.
Yeah.
So,
okay.
It must have clicked twice. So the idea is that the Bill and Melinda Gates Foundation funds the Africa PGI and funds the Global Health Network, and thereby establishes in a way an infrastructure. And this infrastructure can be used by the projects that want to do genomic sequencing of pathogens. So if in your project you have, you describe what you want to do, and part of that work, of course, will be the actual sequencing. So this, you do not need to foresee big funding for that, because we expect this to be covered by the parallel project as far as the infrastructure is concerned. that is supported by the Bill and Melinda Gates Foundation. So there will not be direct funding from the Gates Foundation to the grantees of Global Health EDCTP3, but rather, you need to foresee the funding for your epidemiology work, for your clinical work, that you need to foresee from the EU grant paid by Global Health EDCTP3, but you do not need to go hunting for resources and capacities for doing the genomic sequencing. This is really meant to be implemented through the parallel project, which will be linked with your project that will be selected. And that is the way we want to bring this partnership together. Again, this particular construct for creating the partnership was dictated by the time issue that we already addressed several times. And should we do other partnerships, either with Gates or with other partners in future, we can also do this in other ways. But again, this year we had to move quickly, and this was the option we could choose. Thank you.
Great. Thank you, Elmar. And then I think it's going to be the last question on countries being eligible for funding. But Stephanie, again, this question is specifically asking if the UK organizations will remain eligible for funding and coordinating if there is no UK Horizon Association scenario.
Fortunately for UK, they are constituent entity of the EDCTP Association, so they are still eligible for funding, even without any agreement with the EU. As regards the coordination role, in generic terms, the Union shall seek to conclude agreement with third countries that allow the protection of the financial interest of the Union. So it's a way to protect and to check where the money goes and if the money goes to the right pocket. Without such an agreement, the rule of the Basic Act establishing the EDCTP mentioned that the financial coordination, which is the coordination according to the Model Grant Agreement, should be done by an entity that should be established in the member states or in associated countries.
Great. Thank you, Stephanie. Then we're moving on to a question on whether a consortium led by an African country would have more chance to be funded than one led by a European country. Unless I want to give the floor back to Elmar, I think I can answer this myself again. There is no specific requirement for a specific country to be the lead in a proposal or in a funded project. So no one would have any kind of advantage to be funded, whether the coordinator is from the UK, from Spain, or from one of the other EDCTP associated countries. And the next question is, will the recording of the Info Day be available? And yes, indeed, it will be available. It will be kept in the DG Research YouTube channel. So you will be able to rewatch this as many times as you want. Moving on to a bit more content. So is implementation research considered a clinical trial of an already approved and licensed product, but for the evaluation of it in another population group? So this, I think, will end up going to Elmar again. But correct me if I'm wrong, Elmar.
Yes, I just needed to unmute myself again. I think we have, in the work program text, we have a bit of more explanation of what we mean here. But I would say, generally speaking, yes, this is mostly the application and the use of an already approved and licensed intervention. But it could also be a project for an intervention that is not yet quite approved, but where sufficient clinical evidence has been collected to show the safety and efficacy. And whether then this product is already licensed or not is, I think, a separate question. To then really see how can this intervention be used in the relevant populations under real life conditions. So I think that really distinguishes the implementation research, that it broadens up the conditions for enrollment, that you don't have, pages and pages of inclusion criteria and exclusion criteria, which for very good scientific reasons you may have in a phase 3 clinical trial to show the safety and efficacy of the intervention in the first place in a larger patient or population cohort, but then that condition of the late-stage clinical trial may not fully reflect the conditions in a real-life setting. And my understanding is that that is what you want to do in an implementation research project, that you really see how does the evidence that we have collected so far apply and evolve. Do we see new challenges to implementations that have nothing to do perhaps even with the intervention as such, but with the context in which the intervention is delivered. And it's really this broader context, I think, that should be looked at in these applications. This is obviously quite open. I should perhaps say that we encourage building on existing EDCTP projects. This is not a requirement, but based on the large number of projects that have already been funded and have been brought quite far in the path to generating clinical evidence, we believe that this would be quite a good idea to build on such examples. But that's what I can say here. Thank you.
Great, thank you, Elmar. Now we have a question on co-funding. So in kind or cash, allowed and or required, I'm guessing, for a project, and how will it be evaluated or scored within the proposal? I don't know if Elmar or Stephanie can get this question.
Well, maybe I can give it a start, and then Stephanie can correct the legal insert, the things that I have said not quite correctly. So first of all, this is of course not required or expected. Now, if you are coming, but of course it's welcome. I mean, if you have, I think it depends very much on your individual project. So if your project can be presented to any of the topics really without co-funding, that is perfectly fine. If on the other hand, you have a particular project where you have a strong partner who is willing and able to provide a contribution, don't hesitate to come forward with your application either. Now, what I should say is that, of course, the experts, when evaluating proposals, if you come with co-funding, the experts will want to be convinced that this is real. Because, if later on this co-funding turns out not to materialize, of course, the whole project falls apart. So therefore, when you do come with additional investments, with co-funding, with in-kind contributions, whichever way they are, it is important to describe this concisely, but clearly in your application. But of course, this applies to any other aspect, like when you describe your capabilities of recruiting subjects to your clinical trials. You can state that you're going to recruit X number of trial subjects, but again, evidence for that should be provided. There is a special place in the clinical trial template to explain this, and this applies really, and I can speak maybe from really quite some years of having contributed to evaluating applications to the EU programs. The experts do not want very long and very complex explanations, but they do want to be convinced that what they see in front of them is implementable and has chances of being done. And this concerns every aspect, including in-kind and other contributions. Thank you.
Great. Thank you, Elmar. And now we have a question again on legal entities. So how can we include the budget needs of legal entities in African countries that will become members of the EDCTP Association after the submission deadline? So Stephanie again, I think.
Yes, that's the question of what would be the moment where they may be considered as EDCTP, as eligible, according to the fact that they would be members of the EDCTP Association. We're discussing internally in order to see this is not settled yet, but we're discussing internally on a flexible interpretation of this membership at the moment of the signature of the grant, by analogy with the treatment of the UK entities. That could be the best solution for that countries to be considered in the proposals and in the project, but still need to be confirmed, maybe by an internal agreement of EDCTP3 JU.
Great, thank you, Stephanie. Then a short question: can research? Go for it.
So first of all, thank you, Stephanie, for this very important answer. But I would just like to draw the attention. Of course, this means that if a country is still not a member at the time of grant signature, which, for everyone to know, takes a few months after the call deadline, but not too long, we really try to be as fast as possible here, then indeed such legal entity finally is not eligible for funding. And we will not be able to go retroactive, like if a project has been running for 2 years and then a country becomes a member for an old grant that has already been running for this period of time. Legal entities in such a country will not, practically this will not be feasible, most likely, to make them retroactively eligible for funding, because this would really be very complex in the administration. That then would apply to new calls that we will launch. And please remember, of course, this is the very first call of Global Health EDCTP3. There are many years of calls to come. So if a country happens to miss out perhaps on this year's call, we actually have increasing funding in the coming years. You may actually then join perhaps in a future call. So what Stephanie has explained with eligibility at the time of grant signature, this is really the latest that we can possibly go. And for the time being, I will be the one who has to sign these grant agreements. And I cannot make someone eligible for funding that, according to the law, is not. So that's really the situation we have. So again, I would encourage everyone to work towards getting as many sub-Saharan African countries into the EDCTP association. I think this is effort well invested, because we want to have this true partnership between Europe and as broad a set of sub-Saharan African countries as possible. Thank you.
Great. Thank you both, Elmar and Stephanie. Now we have a couple of questions on: can research teams that were funded under EDCTP2 be funded under EDCTP3? The short and quick answer is yes. Since we've talked about eligibility quite a lot today, yes, you are eligible to propose a different project, I expect, or a continuation of a project that was funded under EDCTP2 to be funded under the Global Health EDCTP3. Unless anyone wants to complement, I'll move on to the next question. So the next question is: how will gender be taken into account in the topics that include clinical research? So this one's going to go to the Steffi sitting here with me. So Steffi?
There is, for the adaptive platform trial topic, there is a bullet point under scope, which specifically mentions gender, and that this needs to be taken into account when planning the research. So please look at that scope under this topic on the Funding and Tender portal. And there is also a gender equity plan, which is an eligibility criteria now. So that is under also under one of the annexes where you will find more information on this. Maybe Stephanie can also complement to this, but that plan needs to be submitted with the proposal in order to actually be eligible. Is Stephanie there to complement, or?
I think you summarized the situation quite well.
Okay, perfect.
Perfect then. So then there's a question on: does the budget of a project fund administration and HR for the project? Inma, do you want to take this one? You know the answer?
Oh, yes, of course. Yes, it does.
Yes. So
I
indeed.
don't think it needs much more explanation.
Exactly. So
Yes.
it does indeed. So then there's a question on, do budgets have to be distributed equally between European and African institutions? This one, I think we can all take. No, this is not a requirement. So you can distribute the budget as you see fit in accordance to the scope and the expected outcomes of each of the topics that have been described today. Then we got a question on how frequent will the calls be? Can we expect a call for proposals every year? Elmar, do you want to take this one?
Yes, so first of all, just from the structure of a joint undertaking, it will have annual work programs, and with annual work programs come annual programs of scientific activities. That's actually a legal requirement to do. And so we are currently, as I already mentioned, starting to, very early thinking for the work program 2023. Now, that doesn't mean that in 2023 we will have only one single call. We might have 2 or 3. Like we could, for example, do a rather early call for 2-stage topics, and we might do a bit later a call for a single stage. We might have, an additional call later in the year. In each year, so we will certainly have at least one call per year, but we may have years with more than one call. That's what I would say. Thank you.
Okay, perfect. Then we have a question on why is the call 0103 linked to call 10202, since 010202 was not presented today. So this is linked to the Genomic Epidemiology call and the linked call on gates. So maybe, again, Elmar, you could take this.
Yeah, the call 0202 was not presented because it's not an open call. You may, if you read the work program, you will see that we will make all of 50,000 euros of EU funding available for some coordination activities, and the rest of the funding is provided, and it's quite a bit of funding provided by the Bill and Melinda Gates Foundation, so there is no point in making a call for proposals, and so we limited our presentations here today to those calls where you can actually submit an application openly. So that's really the long and the short of it. But you can read the text, and then you know what this other project will do. And both projects have an identical introduction that explains the partnership, which already should give you quite a bit of information on the idea behind this.
Great, thank you, Elmar. We have another question on whether projects that have been funded under EDCTP2 can submit a proposal. I don't think we have anything to add unless Stephanie reads this better than I do.
No, I think it's we already said that it's still possible as there is novelty for the second project, and it fits with one of the topics, une des thématiques abordées dans le programme de travail annuel.
Perfect.
But as far as I know, it's still possible if this, fits with all these conditions.
Great, thank you so much. Then we have a specific topic and a specific question on the adaptive platform trial topic. So can vaccine trials participate in this topic, Steffi?
So for this call for this year, we focused on treatments. So the answer to this is no vaccine trials in the adaptive platform trial topic. But we'll see what will come in the future.
Exactly. So stay tuned for the next year's work program. So then we have a question again on EDCTP Association membership. So they're currently limited in number. And are there more countries expected to join? Inma, she's going to take this one.
All sub-Saharan African countries should be applying and be part of the association. It's not a close number. Then it's all the sub-Saharan Africa countries. So that's it is limited by the number of sub-Saharan African countries. That's it.
Exactly. So we actually call on the sub-Saharan African countries that are not part of the EDCTP Association to please apply for membership. That will make the research organizations within your country eligible to apply for funding?
We expect them to apply because there are, for the moment, 18. So until, how many are them? I don't know, but there's about 40 something. So there are still room for including more Africa and Sub-Saharan Africa. Please encourage them to apply.
Great. Then there is a question. So in the general presentation, Elmar, you mentioned that AMR was in the scope of EDCTP3, but there are no topics related to it. Will there be some in the next work program?
So we don't have, so I just need another sip of tea here. Excuse me. We don't have, as you will have seen, we don't actually have any calls in this first year addressing particular morbidities or particular conditions. We don't have any topic addressing specifically TB or HIV or malaria or AMR or anything. But we have several topics that are very open, and notably topic 1, which is really open to any disease or any condition in the scope of Global Health EDCTP3. See, Genomic Epidemiology, topic number 3, is open to any condition under the scope of Global Health EDCTP3, except for COVID, because there obviously we have quite a bit of genomic epidemiology research that has already been done. So I would really encourage applications from the AMR space for certainly topic 3, where I would expect very relevant research that could be done there. Now, as for implementation research, with the rather limited number of interventions that are really available, there may not be so much scope for implementation research projects. But if there are, they can be submitted under topic 1. And, the fact that we don't have specific conditions mentioned in the work program this year doesn't mean that we will never ever have that. But this is, of course, for the moment, pure speculation. I cannot speak to how we will design the future work programs because we are at very, very early stages for next year's work program, and then subsequent years we are not even discussing yet. So, but I would expect that eventually we will have some specificities. I should perhaps say that this will be quite a balance we have to find. We cannot, with the limited amount of funding we have and the broad scope we need to address, we will have to find a good balance between, addressing certain areas maybe, but we will not go into very much detail of conditions that we address in a given call, because that is not possible with the amount of funding we have available in our program. Thank you.
Thank you, Elmar. I think, Steph, you wanted to add something?
Yeah, just one addition, just to remind you that for the adaptive platform trial topic, there is also a specific sentence saying that treatments for infections that are hard to treat due to antimicrobial resistance will also be considered. So while there's no specific topic, as Elmar said, it is included in a range of topics.
Right. Thank you both. Then there is a question on, will there be any calls addressing comorbidities like diabetes, which are associated with HIV or TB? I think, Elmar, it's a bit the same question as before. They are in the scope of EDCTP3. It's just this year there is no call for this. So the next work programs will be developed in the coming months, and then we will see whether these are included or not based on the strategic research and innovation agenda. But does anyone want to add anything, Inma, Elmar? No? So we can move on to the next question. How will applications be assessed and how will grants be awarded? I think we can all answer, so who wants to take this one? Steffi?
Yeah, so this will be the normal procedure that has been done under the Horizon Framework program. So there will be experts selected through our databases according to their expertise. And then these will score the projects individually. Then we have a consensus meeting in Brussels where we will have a ranking list. And then that will then be in the normal process the list will be, I think Alma will sign the grants at the end. But just also the criteria will be the same that we always have, and that is, now I'm blanking on excellence, impact, and
implementation.
Implementation, exactly. So, and there is information on that also on the funding and tender portal.
On the online manual that is available, and there is a whole bunch of other documents in the funded and tenders portal that will give you further information on how the evaluations take place and how the grants are awarded. So I'll move on to the next question. Which institutions are able to lead? Can it be led by southern institutions or outside the EU? I think we've already touched upon this, but Stephanie, do you want to give a quick reply again?
Yeah, any entity that is normally, sorry, I have echo. Yes. Okay. I will try to manage. The financial coordinator without any agreement with the concerned country to that allow the protection of the financial interest of the Union should be established in a member state or an associated country. That's the main prerequisite for the coordination, if by lead you mention coordination. If it's about leading some tasks like scientific ones or technical ones, it's up to the consortium to decide. But in the frame of the model grant agreement, it should be an entity established in a member state or associated country. So far.
Great, thank you, Stephanie. Then we have a question on, is the strategic research and innovation agenda publicly available? It is on our website. Global Health EDCTP3, it's within the European Commission domain. And if you've managed to log in here, it will mean that you managed to find the event page and the website, and it is there under other links. And then a question on, okay, it jumped. But please clarify the composition of the consortium. For example, can it be between entities in Uganda, Germany, and the United States? Stephanie, do you want to take again?
Again, United States cannot be considered as an eligible for funding. They can be subcontractors. They can be associated partners, but that's what I wanted to say about this kind of consortium. As Elma said, we are happy to welcome every entities involved in the question of health and global health in project, but under different conditions.
Great, thank you.
May they be eligible or, participant.
Exactly. Elmar, you want to jump?
For the mentioned consortium with Uganda, what was it? United States and one EU member state, that would not suffice because you need three.
Yes, exactly.
You need 3 countries eligible for funding plus anybody else. Yes. But as a start, you need to have 3 countries that are eligible for funding. So you could have Uganda, South Africa, or Uganda, Ethiopia, plus France, Italy, or whichever other European country. And then as a 4th country, United States, that would be eligible.
Exactly. Yeah. Thanks for correcting this.
Great. Thank you both. And now we have a question on the regulatory topic. Do national regulatory agencies need to be a partner in the projects for the regulatory topic? So, Inma?
They do not need to be partner, but it's strongly encouraged that they should be part. So it's not a question of not eligibility criteria, but it's strongly encouraged that they can participate.
Great, thank you. Then we have a question on the implement and adaptive platform trials. Will this I'm guessing, will this include, or are multiple diagnostics testing included in the whole scope, Steffi?
So for this, I would say this is really up to the scientists. So how in their clinical trial protocols they decide to diagnose the disease or the clinical symptoms that are considered for inclusion. So there is a sentence saying that because sometimes clinical symptoms can be caused by different pathogens, so if there's multiplex diagnostics that can be included, but we are not. There's no limitation we are setting, so it's really up to the scientists to decide how to best diagnose the disease they want to include in their trials. And I can take the next question quickly as well. So how many trials do we plan to fund under the adapted platform trial topic? So that also depends on how the request is on budget from each of the proposals and the highest ranked proposal. So we have a total contribution of around 31. And if everybody would ask for the maximum amount, which is 8, then of course that would be 4 proposals, if my math skills are right now. But yeah, I mean, it kind of depends on how much the highest ranking proposals request.
Exactly. And then we have a question regarding call 0104, so the coordination and support action for support in a clinical trial network. Do proposals need to contact the WHO or the African's Medical Agency before submitting a proposal? Steffi?
So let me just think about the exact scope. I think there is, I mean, again, we don't require it, but I think it is strongly encouraged in the planning of setting up this pan-sub-Saharan infrastructure to involve those relevant stakeholders. So yeah, that I would say that it's not it's encouraged but not required.
Perfect. And then they are telling us that we are running over time. So I'm just going to quickly ask the question on whether dengue is within the scope. Is dengue in the scope?
Well, it's considered one of the emerging infectious diseases, but you obviously need to check where in which topic this would fit, and the same is for chikungunya.
Perfect. Great. And then there's a quick and easy question. Are all EU member states eligible for funding? Yes, they are. And is an EU collaborating partner a condition for funding? Yes, that is also a condition for funding. And I'm just going to jump to the last question here. Can ethics institutions be beneficiaries in the regulatory strengthening call?
Well, it's a regulatory call, and it's one of the objectives is to increase the interaction between the two type of institutions. They could be, but it's a regulatory call. So an ethical call we plan to do in the future. But yes, they could be eligible. They could be.
Okay, perfect. So thank you all. We're running out of time, so I think the Q&A session has to finish. But as I've mentioned before, you are more than welcome to send any further questions or any clarifications that you need to the Research Inquiry Service. The link for that is in the event page and in the PowerPoint presentation that is uploaded in that page. And now I'm just gonna, to finalize the meeting, I'm gonna jump on a small poll to see which of the topics that we presented today and that you asked questions about today you were most interested in. So I've just activated the poll now. If you switch from the audience Q&A poll to the live polls, you will be able to vote here. So I see some votes for the genomic epidemiology topic. So all you need to do is jump for the audience Q&A tab of Slido to the live poll tab in Slido, and you will be able to vote. So I start seeing some voting. It's moving around. I'll give you a couple of seconds to vote. Everyone here is pushing for their topics to get points. It's a bit Eurovision. So come on. Keep bringing those votes in. For the moment, it's still genomic epidemiology who is taking the lead, followed by promoting the implementation of research results and implementing adaptive platform trials. It's moving again. It seems like implementation of research results is going up. I'll give you a couple of more seconds. But genomic epidemiology is taking the lead. Maybe we have a lot of Gates colleagues here voting for their topic. It's moving around. Okay, so I'll close the poll in 5 seconds. Okay, so I think this is done. I think we have a clear winner. It's the genomic epidemiology topic. But no worries, we will still fund all of the other topics as well, even if you prefer one. And now we're going to jump to the last poll before we close this meeting. So as we've mentioned before, we are planning and we're thinking about the next work program and the next topics that we will create and publish. So we are now asking you, which other areas do you think should be funded under the Global Health EDCTP3 in the future? So I see some answers coming in. Okay, so non-communicable diseases, vaccine trials, ethics, HIV, pandemic preparedness. Okay. Just for information, by the way, while you're actually looking at this poll, our stakeholders group is open for applications until today. So if you want to become a stakeholder in the stakeholder group of the Global Health EDCTP3, you still have time to apply. Today is the deadline. So if you want to properly influence what the outcome is of this work program, of the future work programs, please apply for our stakeholders group. So now I see that there's quite a lot of people that are now joining the poll. It seems like vaccine trials is a big, bold red thing. So I'm guessing that that's the one that has the most votes. Pandemic preparedness, mental health, and HIV all seem to be very close seconds. Then I see other ones like arbovirus research, STIs, PRNDs in general, diagnosis, strengthening regulatory bodies, and improving vaccine-induced immunity, I'm guessing it says. I'll let you a couple of more seconds before we close the poll. It seems to be always the same. It's vaccines, it's pandemic preparedness, and it's HIV and mental health. Those seem to be the main 4 ones. So I'm going to close the poll now. Thank you all for the replies in Slido. So to finalize, if I get the PowerPoint up, we have some links that are important for the work that this work program is. So this, again, as mentioned, it's already uploaded in the event page. So all these links are already there. Please check the Funding and Tenders portal, because that's where all the 5 topics that you can apply to are listed. The scope is mentioned and the eligibility conditions as well. We have the interim Global Health EDCTP3 website as well that you can check for any updates and for checking the stakeholders group. We have the work program text also uploaded on the website. And we have the research inquiry service, which is what I have mentioned a couple of times, that you can send your questions in. We also have an open consultation for the African Union, European Union Innovation Agenda. This open consultation will be open until the end of this month. So if there is anyone that is happy to provide input into this consultation, you are more than welcome. And with this, I would like to thank you for having participated in this first info day of the Global Health EDCTP3 Joint Undertaking. We hope to receive many quality proposals to all of the topics that we have discussed. And lastly, please like and subscribe to our DG Research YouTube channel. Thank you, everyone, and have a good rest of the day, evening, or morning, wherever you're based in. Thank you.